Welcome back to the channel. Today, we're diving into a very important topic, 9 ovarian cancer signs that you should not ignore. We're going to cover the signs, the symptoms, when to be concerned, and when to see a doctor. Early detection can save lives, so make sure to watch till the end and share this video with your loved ones. So you know that feeling after you have a big meal and your stomach feels kind of like a balloon? That's bloating. It's that uncomfortable sensation where your abdomen feels tight, full, and sometimes even painful. It can make you feel sluggish and uneasy, and it's often accompanied by a noticeable swelling of the stomach area. And it's totally normal after a big meal. When you indulge in a feast, your stomach has to work overtime to digest all that food, leading to temporary bloating. This is a common experience during holidays, family gatherings, or any event where you might eat more than usual. Your digestive system is simply responding to the increased workload. But if you're feeling that way all the time, or if it just won't go away, that's when it might be something more serious. Persistent bloating isn't just an occasional inconvenience. It can significantly impact your daily life. Imagine waking up every day with that same uncomfortable, swollen feeling, regardless of what you eat or drink. It can be distracting, painful, and even debilitating. We're talking about persistent bloating, the kind that sticks around for weeks or even months. This isn't just a fleeting issue. It's a chronic condition that can signal underlying health problems. When bloating becomes a constant companion, it's essential to pay attention to your body and seek medical advice. This isn't just about eating too much pizza, guys. While diet can certainly play a role in bloating, persistent bloating often points to more serious health concerns. It's not just about overindulgence in junk food. It could be a sign that something more significant is happening within your body. Persistent bloating can be a sign of ovarian cancer, especially if it's accompanied by other symptoms like pelvic pain or feeling full really quickly. Ovarian cancer is often called the silent killer because its symptoms can be subtle and easily overlooked. Bloating, along with other signs like frequent urination, changes in bowel habits, and unexplained weight loss, can be early indicators of this serious condition. So if you're experiencing this, don't just try to suck it in and ignore it. Ignoring persistent bloating can lead to delayed diagnosis and treatment of potentially serious health issues. It's crucial to listen to your body and take action when something doesn't feel right. It's really important to get it checked out by a doctor, just to be safe. A healthcare professional can help determine the cause of your bloating and recommend appropriate tests and treatments. Early detection and intervention can make a significant difference in managing and treating underlying conditions. So don't hesitate to seek medical advice if you're dealing with persistent bloating. Your health is worth it. Let's talk about pain, specifically in your pelvic or abdominal area. This type of pain can be quite distressing and can affect your daily activities, making it hard to focus on anything else. We all get aches and pains from time to time, but if you're experiencing a persistent pain that just won't quit, it's time to pay attention. Persistent pain can be a signal from your body that something isn't right, and it's important to listen to these signals. This kind of pain, especially if it's new or unusual for you, could be a sign of something more serious, like ovarian cancer. Ovarian cancer is often called the silent killer because its symptoms can be subtle and easily overlooked. Now, I know what you're thinking. Dr. Mike, pain is subjective. How am I supposed to know if it's a big deal? It's a valid question because pain can vary greatly from person to person. And you're right, everyone experiences pain differently. What might be a minor discomfort for one person could be debilitating for another. This is why it's crucial to pay attention to your own body and how it feels. But here's the thing. You know your body best. You are the expert on what feels normal for you and what doesn't. If something feels off, it's worth investigating further. If something feels off, if the pain is interfering with your daily life, or if it's just plain not normal for you, don't ignore it. Pain that disrupts your routine or causes significant discomfort should never be dismissed. Go see a doctor and get it checked out. Early detection of any potential issues can make a significant difference in treatment outcomes. Your health is too important to ignore, so take action and seek professional advice if you're experiencing persistent pelvic or abdominal pain. Remember, it's always better to be safe than sorry. Regular checkups and being proactive about your health can help catch problems early, giving you the best chance for a positive outcome. So, listen to your body and don't hesitate to reach out to a healthcare provider if something doesn't feel right. Taking care of your health is a lifelong journey, and being attentive to your body's signals is a crucial part of that journey. Stay informed, stay proactive, and most importantly, stay healthy. We've all been there. You sit down to a delicious meal, excited to dig in, but then just a few bites in, you feel uncomfortably full. It happens occasionally, right? But if you're consistently feeling full really quickly, or if you're just not interested in food like you used to be, it's worth paying attention to. This change in appetite, especially if it's accompanied by unexplained weight loss, can be a sign of ovarian cancer. The tumor growing in the ovary can press on your stomach, making you feel full even if you haven't eaten much. So if you're noticing this change in your eating habits, don't just brush it off as getting old or being busy. Talk to your doctor about it. All right, guys, let's talk about pee. It's something we all do, multiple times a day, and it's a natural part of life. But sometimes our urinary habits can tell us more about our health than we might realize. We all do it, it's a natural part of life. But what happens when those habits change? Maybe you're finding yourself needing to go more often, or perhaps the urgency to pee is becoming overwhelming. But if you're finding yourself running to the bathroom more often than usual, it can be more than just an inconvenience. It might be your body's way of signaling that something isn't quite right. Or if you feel like you have to pee urgently all the time, it can disrupt your daily life. This constant need to go can be uncomfortable and even embarrassing. It could be a sign of something going on. It's important to pay attention to these changes and not just brush them off as minor annoyances. Now, I know what you're thinking. Dr. Mike, that sounds like a UTI. And you're right, frequent urination can be a sign of a urinary tract infection. UTIs are common and can usually be treated with antibiotics. And you're right, frequent urination can be a sign of a urinary tract infection. But it's not the only possible cause. There are other conditions that can lead to similar symptoms, but it can also be a symptom of ovarian cancer. This is a more serious condition that requires immediate medical attention. Ovarian cancer can present with a variety of symptoms, and frequent urination is one of them. As the tumor grows, it can press on your bladder, causing you to feel like you need to pee all the time. This pressure can be uncomfortable and persistent, making you feel like you have to pee all the time. It's not just a minor inconvenience, it can be a sign of something much more serious. So, if you're noticing a change in your urinary habits, don't just ignore it. It's easy to dismiss these symptoms, but they can be an important clue to your overall health. Talk to your doctor and get it checked out. Early detection and treatment can make a significant difference, so don't hesitate to seek medical advice if you notice any changes. We all feel tired from time to time, especially in today's fast-paced world. But we're not talking about your average end-of-the-day fatigue here. We're talking about chronic fatigue, the kind that just doesn't go away no matter how much sleep you get. The kind of fatigue that makes it hard to get through your day, the kind that makes you feel drained and exhausted all the time. This kind of fatigue can be a sign of many things, including ovarian cancer. So if you're feeling constantly exhausted, don't just try to push through it. Talk to your doctor and figure out what's going on. Back pain is one of the most common complaints I hear from my patients. And let's be real, we put our backs through a lot. But here's the thing, not all back pain is created equal. If you're experiencing persistent back pain, especially if it's not related to any physical activity or injury, it's important to pay attention. This kind of back pain could be a sign of something more serious, including ovarian cancer. As the tumor grows, it can press on nerves and muscles in your back, causing pain. So if you're dealing with back pain that just won't quit, don't just reach for the pain relievers and hope for the best. Go see a doctor and get it checked out. Let's get real for a minute, guys. We all poop. It's a natural part of life. But if you're noticing changes in your bowel habits, like constipation or diarrhea, that are persistent and just won't go away, it's important to pay attention. These changes could be a sign of something more serious, including ovarian cancer. As the tumor grows, it can press on your bowels, affecting how they function. Now, I know talking about poop can be a little awkward, but trust me, it's better to be safe than sorry. If you're experiencing persistent changes in your bowel habits, don't ignore it. Talk to your doctor. Now, I know we live in a society obsessed with weight loss, but trust me, losing weight without trying is not a good thing. If you're suddenly dropping pounds without making any changes to your diet or exercise routine, it's a major red flag. This kind of unexplained weight loss can be a sign of many things, including ovarian cancer. As the tumor grows, it can release substances that affect your metabolism and appetite, leading to weight loss. So if you're noticing the numbers on the scale going down without any effort on your part, don't just brush it off as a lucky break. Go see a doctor and get to the bottom of it. Ladies, let's talk about periods. We all know they can be a bit of a pain, literally. But if you're noticing changes in your menstrual cycle, like irregular periods or bleeding after menopause, it's important to pay attention. These changes could be a sign of something more serious, including ovarian cancer. As the tumor grows, it can affect your hormone levels, leading to changes in your menstrual cycle. So if you're experiencing any unusual bleeding or changes in your periods, don't just ignore it. Talk to your doctor and get it checked out. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health tips and information. Don't forget to share this video with your friends and family. Stay healthy and take care.